Many times in orthodontic treatment, an orthodontist may choose to use functional appliances. To understand what functional orthodontics is functional orthodontics includes appliances that we may give to a patient to try to help promote a forward placement of lower jaw or thereby enhance whatever growth may be available. In using a functional appliance, we're trying to relate the dental and skeletal structures into a better relationship, which would allow for less tooth movement once all the permanent teeth are completely erupted. Many of the functional philosophies in orthodontics were adopted over in Europe back in the early part and latter part of the 20th century. And part of the reason why those appliances were adopted in Europe is they had socialized dentistry. And the governments wanted to find ways to treat patients or the masses more economically. So as a result, they started to use removable appliances and such to try to change the way patients were growing earlier so that when they had all of their permanent teeth in, there was less problems that they were required to make correction to. One of the partners of our founder in this practice, Dr. Colarusso, was Carl Gugino. Carl lectured over in Europe back in the 60s and brought back some of these European philosophies into our practice. And by doing so, we were one of the early adopters of functional orthodontic treatment. Today, there are many different types of functional appliances, and we try to time the use of those appliances to when the patient is experiencing a growth spurt. That is a critical component to making decisions on when to use these appliances.